Good afternoon. I'm Johnnie Carswell, Chairman of the Burke County Board of Commissioners, and with me today are Scott Mulvey, Vice Chairman of the Board of Commissioners, and Lisa Moore, Burke County Health Department and Burke County Public Information Officer. We want to take this opportunity to speak to you frankly about the COVID-19 pandemic that has spread through Burke County. We are aware that the last few weeks have been challenging and that there have been changes to our daily lives that we would have never imagined before. This disruption in our lives has caused financial difficulties for some and sadly grief for others. I unfortunately must report that there have been 28 positive COVID-19 reports made to Rebecca McLeod, Burke County Health Department Director, as of today, and then unfortunately there has been one death reported as a result of COVID-19. We are deeply saddened, and our hearts and our prayers go out to the family and friends of this individual that passed away. We know that everyone that cared for this individual did everything they could, and we greatly appreciate their effort. At this time, I want to recognize Lisa, who will give you the latest update on state-mandated procedures for screening and testing for COVID-19. Lisa?
Hi there. Thank you, Commissioner Carswell. I want to start with a memory. On September the 11th, 2001, human terror killed Americans and brought communities together, unifying Americans across the U.S. Then many Americans filled churches across America to pray for those who lost their lives, the families they left behind, and the leaders of the U.S. to make good decisions moving forward. Today, the terror is a virus called COVID-19, and it is killing people across the U.S. and the world. So just like in 2001, when everyone came together as a community, one unit, all working together to support and help each other, today we have the same need. We all must work together to keep everyone safe and healthy. Now is not the time to panic, but to pay closer attention to what you are doing when you are out in public, and then take measures to keep everyone as healthy as possible. I am here to remind you how COVID-19 is spread, the symptoms, and the newest guidance from the state. COVID-19 is easily spread from person to person through droplets from someone who is infected with COVID-19. Between people who are in close contact with others within 6 feet or less for 10 minutes or longer. Spread through droplets when an infected person coughs, sneezes, or talks. When droplets lay and land in the mouths or noses of people who are close by. Maintaining social and physical distancing is very important in preventing the spread of this infection. It may be possible for a person to get the virus from touching a surface or an object that has been touched by someone who is infected, and then they touch their eyes, their nose, or mouth before washing their hands or using hand sanitizer. Most people who have COVID-19 will have symptoms of the illness, but some people without symptoms may be able to spread the virus. The symptoms for this virus are fever, cough, and shortness of breath. But there have been some people that have not had symptoms but carried the virus and spread it. The newest recommendation from the state is as follows. For those with mild symptoms, treatment is to focus on managing those symptoms, stay hydrated, and stay at home, and isolated away from others as much as possible within the home. A test will not change how mild symptoms are managed. Residents are encouraged to call their medical provider if they have symptoms consistent with COVID-19, but they do not need to come out to be tested since it may spread the illness to others in the community, including those at high risk for complications and healthcare workers. People who are not infected with COVID-19 can become infected when going out to get tested, especially at healthcare sites. People in congregate living situations, such as but not limited to long-term care facilities, group homes, jails, etc., who have mild symptoms, fever or cough, consistent with COVID-19, that do not progress to severe symptoms, which are shortness of breath, difficulty breathing, chest discomfort, altered thinking, and cyanosis, which is blue lips or bluish skin. Do not need testing for COVID-19 and are instructed to stay isolated from others to recover. If symptoms worsen, then medical care will need to be sought. Patients who have mild symptoms consistent with COVID-19 need to self-isolate at home for at least 7 days, have passed since symptoms have first started, and at least 3 days or 72 hours have passed since recovery, which is defined as fever is gone without the use of fever-reducing medications and improvement in the respiratory symptoms, cough or shortness of breath. Household members and other close contacts within 6 feet or less for longer than 10 minutes of a person with known or suspected COVID-19 should stay at home for 14 days after the last exposure. Stay at least 6 feet away from others, self-monitor their temperature and symptoms, and self-isolate if they develop symptoms. The goal is to decrease the spread of this virus among the populations, especially those at highest risk, so that fewer people need medical care at the same time. In addition, they are implementing strategies to try to save supplies and critical workforce so that healthcare workers and first responders can care for the people who have more severe symptoms during this outbreak. I was also asked to address wearing masks and when to wear masks. As of this weekend, the Centers for Disease Control has changed their guidance regarding wearing masks or using face coverings. Here is what the CDC now recommends. Since it has been found that some people who do not have symptoms of this infection are in close contact with others when speaking, coughing, or sneezing, and can transmit this infection, the CDC is recommending that people wear masks or cloth face coverings in public settings where social or physical distancing cannot be done, like grocery stores, pharmacies, convenience stores, etc., especially in areas where there is a lot of community spread of this infection. It is critical for you to know that staying at home away from others and practicing social and physical distancing of more than 6 feet remains the best option for slowing the spread of this infection. CDC is advising the use of cloth coverings for the general public and can be made from common household materials. This is how to wear your cloth face covering. You must wash your hands with soap and water for 20 seconds or use hand sanitizer before putting the mask on. It has to fit snugly around the face, around the nose, and down under the chin. Needs to be secured with ties or ear loops. It should include several layers of fabric, but not allow for breathing without restricting airflow. You have to be able to breathe within the cloth. Be able to be washed and machine dried without damage to the fabric or change in the shape, and should be routinely washed. It is extremely important that you do not touch the outside of the mask when you are wearing it, and do not touch your eyes, your nose, and your mouth while wearing the mask. It is also very important not to touch the outside of the mask when you are taking it off. Grasp the ear loops only and throw away in a closed trash can, or if it is a disposable mask, or put in a separate laundry container from other clothes or surfaces until it is washed and ready to wear again. Then wash your hands again with soap and water or use hand sanitizer. Face coverings should not be used on children less than 2 years of age, anyone who has trouble breathing, anyone who is unconscious or incapacitated or unable to remove the face covering without help. Surgical masks or N95 masks are in really short supply and only needs to be used by healthcare workers or first responders when responding to calls or treating sick patients. Household needs to develop a plan for possible illness in their home. Choose a room in your house that can be used to separate a sick household member from others. Create a list of emergency contacts if the need arises. If someone becomes sick with symptoms consistent with COVID-19, do not plan to leave the house until the symptoms have resolved and the other family members wait 14 days and monitor to see if anyone else becomes sick. Have a list of individuals that you can call to pick up any essential items needed while you are isolated, and they can leave them at the door. If you are caring for a sick family member, wear a face covering and do not share personal items. Keep surfaces clean and disinfected. Avoid touching your eyes, your nose, or your mouth with unwashed hands. Cover your cough or your sneeze with a tissue and then throw away, and wash your hands or cough and sneeze in your elbow. Stay informed of any changes within your community. This is a lot of information, but is extremely important for everyone to follow so that we can all work together to decrease the spread of this infection and get back to our normal life as soon as possible and keep everyone as healthy as possible.
Thank you, Lisa, for that update. That was a great update and a lot of information, so I hope that you will go back over this and take heed to what Lisa has said. On March 30th, Governor Roy Cooper executed a stay-at-home order for all North Carolinians in order to help reduce the amount of time that people spend around others to help reduce the spread of this virus throughout our communities. I have also issued a state of emergency for Burke County with additional restrictions that include the Pisgah National Forest and the Linville Gorge and travel into the county by visitors. I cannot impress upon you enough the seriousness of this virus and the complications associated with it, and I strongly encourage all Burke Countyans to comply with these orders and limit your contact with others, especially those that are a high risk of complications from the virus. It is no secret that several cases of COVID-19 have been reported at a local health and rehabilitation center. Please let me assure you that the management of this facility have been in very close communication with the Burke County Health Department and state and federal health officials to ensure that they are taking the appropriate and recommended actions to bring an end to their current situation. At this time, I want to recognize Scott Moe, our Vice Chair, for more comments about the stay-at-home orders. Scott?
Thank you, Johnny. First and foremost, we strongly encourage you to stay at home as much as you possibly can and stay away from others. Also, if you do not feel well, please stay at home. Travel outside your home is only recommended for medical services, including visits to pick up medication, picking up essential items like groceries, home business supplies, or to care for or deliver supplies to family members, especially those at higher risk of this virus. If you must travel outside your home, we again strongly encourage you to please follow these simple steps to keep everyone safe and healthy. Please limit the number of times that you must leave your home. Make a list of essential items that you or other family members may need in order to limit the number of trips that may be needed to local businesses. Please do not travel within the state or outside the state unless it's an absolute emergency. Traveling continues to put people at risk, especially if you travel to an area that has more positive cases than Burke County. Please limit the number of family members, including children, needed to make a trip to purchase essential needs. If a child must accompany you, please have another adult keep the child in the car if possible until shopping for essential needs is completed. Please don't go into a business that may be already crowded and you cannot keep social, physical distance of 6 feet or more. Wait in your car until others in the store leave and it is safer for you to enter. Please make sure your length of stay in a business is as short as possible, and do not use the public restrooms if possible. Please make sure when you are out in public that you refrain from touching product as much as possible. Remember that other people may have touched items and surfaces too. This virus can live on surfaces for an extended period of time. Please be sure to clean the essential items you purchased when you get home. Please make sure that you wash your hands for 20 seconds or more when you get home after leaving the store. Please do not buy more essential items than you need. Have respect for other people's needs as well. Please use hand sanitizer as much as practical. And one of the most important things to remember is do not touch your face, including your eyes, nose, and mouth, to reduce the spread of this virus to you and others. For our business community, if you have not been identified as an essential business under the governor's order, please remain closed. If you've been identified as an essential business under the governor's order, we strongly encourage you to follow all rules from your corporate offices. We also encourage you to clean all common surfaces, shopping carts, doorknobs, commonly used phones, essential equipment, computers, and keyboards multiple times a day with an approved disinfectant. We strongly suggest that all employees remember to maintain a social physical distance of 6 feet or more. During the governor's media briefing on Friday, April 3rd, he asked businesses that had customers to limit the number of customers within the store. Lastly, I want you to know that we have made recent contacts with our major businesses here in Burke County, and we've been assured that they will comply with all directives from the state and the county, and as they are truly concerned with the health and safety of their staff and the citizens of Burke County that they serve.
Thank you, Scott, for that update. I want to make just a few more comments. First, as a person of faith, it has been difficult to encourage churches not to meet in person and find alternate ways of delivering a message. Since the explosion of common spread of this virus among counties and states, churches have found other ways of engaging their congregations in worship to help reduce the spread of this virus. There has been clarification through the governor's office to grant permission for churches to meet within their parking lots as long as families stay in their cars. The cars 6 feet apart, and no one gets out of the vehicles to go from car to car. Since the most recent executive order by the governor restricting no more than 10 people to congregate for any purpose, we are still strongly encouraging churches to use live streaming for your services if possible. Our Burke County Incident Management Team meets daily at 3 o'clock at the 911 Center for updates and a strategic planning session. This team is made up of number 1, Rebecca McLeod, Burke County Health Department Director. Number 2, Mike Willis, Burke County Emergency Services Director and Burke County Fire Marshal. Number 3, Steve Whistnett, Burke County Sheriff. Number 4, Greg Curry, Burke County EMS Director. Number 5, Drew Thomas, Vice President of Carolina's Healthcare System, Blue Ridge. Number 6, Brian Steen, Burke County Manager. Number 7, Margaret Pierce, Deputy Burke County Manager and Finance Officer. And lastly, myself, Johnnie Carswell, Chairman of the Burke County Board of Commissioners. I want you to feel comfortable in knowing that the decisions we make daily are based on the best data that is available to us, and please remember that this data is fluid. We all have family in this county, and we totally understand the gravity of COVID-19 and it is and will continue to be our goal to keep Burke County as safe as humanly possible. We implore you to strongly scrutinize the information that is being posted on social media to determine, is it really the truth? We certainly do not need unsubstantiated rumors being posted on social media causing havoc in our daily lives. We want you to be informed with the truth. So for general questions about COVID-19, you can call the Burke County Public Information Line at 828-764-9388, where one of our team members will serve you. We encourage you to also visit the COVID-19 webpage at www.burkenc.org/COVID-19. You can also visit the North Carolina Department of Health and Human Services COVID-19 webpage at www.ncdhhs.gov. Please, and I reiterate, please do not call 911 with general questions about COVID-19. I want you to consider that our Burke County EMS personnel, our first responders, our sheriff's office personnel, our municipal police officers, our fire personnel, our correctional personnel, and all of our essential personnel to include doctors, nurses, healthcare professionals at Broughton, NCSD, J. Iverson Riddle, our nursing and assisted living centers, DSS, health department, and our county and municipal governments are coming to work each day to ensure that your needs are met. These dedicated individuals are subjecting themselves to the chance of contracting COVID-19 every day they go to work to make Burke County a safer place to live. Please remember these dedicated professionals in your prayers as they come to work every day. Please remember this. There will probably be more positive cases of the virus reported, and unfortunately there may be more deaths, so there is a strong need for concern, but I do not want you to panic. In closing, I cannot stress enough that it is crucial that everyone remembers to abide by Governor Cooper's order to stay at home and my state of emergency order for Burke County, and especially the practice of social physical distancing. We can fight this virus together, but everyone must be responsible to do their part. I want to thank our interpreters who are with us today. And as I close, God bless you, God bless Burke County, and please stay home and please stay safe.